Assalamualaikum. Hello everyone, my name is Amna and welcome back to my YouTube channel. As a pharmacist, I'm very passionate about sharing my knowledge and expertise with you through this platform on this channel, and you can expect to find more videos about a variety of topics related to pharmacy and much more. I also want this channel to be a space for engagement and discussion. So if you have any question or suggestion for future videos, please don't hesitate to leave a comment and send me a message. Thank you for joining me on this journey, and let's get started. 1. Phenytoin usage other than anticonvulsive agent are TT irregular heartbeat, TT painful nerve conduction neuralgia, class 1B anti-arrhythmic. Phenytoin is primarily known for its use as an anticonvulsant medication. However, it has been used for the other medical conditions such as irregular heartbeat. Phenytoin has been used as class 1B anti-arrhythmic medication to treat certain type of irregular heartbeats. Phenytoin can be used for the treat certain types of nerve pain such as trigeminal neuralgia, diabetic neuropathy, and post-herpetic neuralgia. It is important to note that the use of phenytoin for these conditions should only be under the guidance of a healthcare professional. So the correct answer is E. Number 2. Arrhythmia due to dysfunction in generating heart pulse or conduction of it. C. Heart attack, or D. All. Arrhythmia can be caused by dysfunction in generating heart pulse or conduction of it. This means that electrical signal from the heart that control the heartbeat may not be functioning properly. This can cause the heart to beat too fast and too slow or irregular. Arrhythmia can also be caused by other factors such as heart attack, which can damage the heart muscle, disrupt the normal electrical activity of the heart. Other factors that can cause arrhythmia include blood pressure, coronary artery disease, electrolyte imbalance, and certain medication. Therefore, the correct answer is all. Arrhythmia can be occurred with disease. Hydrazine A, vasal relaxation, it dilates arterioles more than veins. Sugar increase, A and B. Hydrazine is a medication that is used to treat high blood pressure by relaxing the blood vessel. It primarily dilates arterioles, smaller blood vessels that carry blood from arteries to the capillaries, which reduces peripheral resistance and lower blood pressure. Hydrazine does not typically affect the veins as much; it affects the arterioles, as it is often referred to as an arteriolar vasodilator. Therefore, the statement "it dilates the arteriole more than veins" is correct, and it does not associate increased sugar level. Guanethidine side effects are diarrhea, orthostatic hypotension, prevent ejaculation, or all. Guanethidine is a medication that works by blocking the release of certain chemicals that cause blood vessels or constrict when people help to lower blood pressure. The medication is no longer commonly used in critical practice due to a significant side effect and potential complication. The most important side effect of guanethidine include diarrhea, orthostatic hypotension, a sudden drop in blood pressure when standing up. These side effects occur because of guanethidine can affect the autoimmune nervous system, which regulates many of the body's automatic functions such as blood pressure, heart rate, and digestion. Guanethidine can induce cause all the listed side effects, including the diarrhea, orthostatic hypotension, and decreased ejaculation. The side effects occur due to medication effect on autoimmune nervous system, as mentioned earlier. So all. From WBCs, lymphocytes, leukocytes, reticulocytes, or none. Leukocytes are also known as white blood cells, which are a type of blood cell that play a role in body's immune system. They help to fight off infection and protect the body against foreign invaders. Lymphocytes are a specific type of white blood cell that are involved in adaptive immune response, which means they help the body develop immunity to specific pathogen or foreign substance. Reticulocytes, on the other hand, are immature red blood cells that still contain some organelles such as ribosomes, mitochondria, that are typically found in the bone marrow and released into the bloodstream or eventually mature into fully functional red blood cells. The correct answer is C. Reticulocyte is not from WBCs. About minoxidil, it decreases myocardium contractility, dilate arteries only, cause bradycardia, or none. The correct answer is dilate arteries only. Minoxidil is a direct-acting vasodilator that works by relaxing the smooth muscles in arterial blood vessels, which lead to dilation of the vessels and decrease in blood pressure. It has little or no effect on veins. It distinguishes it from the vasodilator that affect both arteries and veins. Thank you. Non-sedative, antihistaminic, antiplatelet, anticoagulant, weight gain, antibiotic. Mezolacin is a medication that belongs to the class of drug called antihistamine. It works by blocking the effect of histamine, a substance to decrease release during an allergic reaction, cause symptoms, itching, sneezing, and runny nose. Mezolacin is a non-sedative antihistamine, which means does not typically cause drowsiness or sedation side effect. So the correct statement, non-sedative antihistamine. Mezolacin is an antiplatelet or anticoagulant, which means that it does not have direct effect on blood clotting. So the antiplatelet and anticoagulant are not correct. Mezolacin is not cause weight gain. So the correct not antibiotic. These drugs are anti-metabolite except cisplatin, guanidine, digoxin, procainamide, and verapamil. Yes, cisplatin is a chemotherapeutic medication that works by damaging DNA or interfering with cell division. It is not anti-metabolite medication, so the statement except cisplatin is correct. Guanidine, digoxin, procainamide, and verapamil are medications that work by affecting the heart electrical activity or contraction. They are not anti-metabolite medications, so the statement all these drugs are anti-metabolite except is also correct. Cisplatin. Captopril inhibitor do all the following except increase renin concentration of blood, inhibit enzyme, and competitively block angiotensin 2 at its receptor site and raises blood potassium concentration, hyperkalemia. So the correct answer is competitively block angiotensin 2 at its receptor, because captopril inhibitor are angiotensin converting enzyme inhibitor, or they work by inhibiting the conversion of angiotensin 1 into angiotensin 2. Angiotensin 2 is a potent vasoconstrictor that raises blood pressure. By blocking the effect of angiotensin 2 at its receptor, captopril inhibitor have to lower the blood pressure. Reducing what is not true. Taking orally, hypothalamus hormone, iodine deficiency cause, and the all of the above. Yes, all of the above is the correct answer because reducing not taking orally and it administered by various route including IV, intramuscular. Reducing medication used to treat heart failure and certain types of irregular heartbeat, whereby slowing down the heart rate and increasing the strength of the heart contraction. It is important to note that digoxin can have serious side effects and should not be taken under the supervision of health. Thank you so much for watching this video. I hope you found it informative and helpful. If you have any question or suggestion for more future videos, please don't hesitate to leave a comment or send a message. And if you enjoyed this content, please consider subscribing to my channel and turning to the notification bell so you don't miss out any future videos. Remember, taking care of your health is one of the most important things you can do yourself. Thanks again for watching. I will see you in the next video.